offering the first drive-up testing for COVID-19 in our area at Lake Oconee. So if you would, I'm going to give them a floor. Dr. Eddie's going to talk about, and Dr. Gator's going to talk about just educating you on the COVID and like the mask and all that good stuff. So who's doing the mask?
Take it away.
Take it away.
All right, I'm going to talk
Eddie.
about the testing. Hello everyone, and thank you for listening in. Hey, we just want to share with you guys, we're one of the first centers in the area to be testing for COVID-19, and we perfected it now to be doing a drive-up testing. So as you see on the screen, as we get in the preview, you need to give us a call.
Keep going. Okay.
It'll give us a call.
Got our number. 706-484-0884.
That's our number, and then we can set you up for a telemedicine visit. We can do it right over the phone through Zoom, and then if we deem you have the symptoms and you need the testing, then we can bring you in for a drive-up testing. You just come up to the center, come to the parking lot, call us once you're here, and then we'll have someone come out to your car and swab you. And this is actually the swab that we use. This is the test kits that we're talking about that everybody's wanting to get a hold of. We have a good many of them, and so we're able to test some. We can get results.
How do you swab? Where does the swab go?
The swab actually is a nose swab. It goes up into your nary.
It's like a Q-tip, and it goes right in your nostril.
Yes.
Just a little swab.
And then we swab you, and then we send it off. We can get test results back within 24 to 48 hours. That you will have a result on the testing for yourself. And Dr. Gator's going to tell you what the symptoms are that you have to have that qualifies you for the testing.
So we've been talking a lot about COVID-19, and a lot of patients know to watch out for fever, shortness of breath, or cough, and those were the telltale symptoms that all of the doctors were learning about initially. But now, as things have progressed, especially working in the ER, we're seeing patients that present with a variety of symptoms, including abdominal pain, severe fatigue, loss of appetite, loss of sense of smell or taste. Now, some of those symptoms like fatigue and smell or taste can be very generalized symptoms. They can be due to many things, even other respiratory infections. However, in light of what's going on, if you have those symptoms, then it definitely is in your best interest to go ahead and have a telemedicine visit, let the doctor evaluate you, and then determine if your symptoms are consistent with COVID-19. Now, if you have a very suspicious set of symptoms, then we actually will send an electronic online form to the Department of the health department, so that they know that you're a person of interest, that you're someone who we're really concerned may very well have COVID-19. And then we certainly will have you come in, we'll swab you. If you have lesser symptoms but we're still concerned, we'll come in and swab you. And then if for some reason you are positive, we do report that to the Georgia Department of Health so that we can keep everyone healthy. Usually then they go back and try to figure out where that person may have contracted the coronavirus, so that then we can maybe isolate and find other people who may be infected. And again, just helping the public health, making sure we can do as much testing as we can so that people do in fact know whether they have it or not. And if they are positive for it, they can then stay home and everyone can make sure that we're keeping each other safe. At this point, we don't have enough testing to do asymptomatic patients. So if you really feel fine and don't have symptoms, we really do need to prioritize the number of tests that we have for the folks who are symptomatic so that we can get them the treatment that they need. So speaking of treatment, there's been a lot of talk about hydroxychloroquine, which is a medicine that's used to treat malaria. It's also used for some autoimmune disorders like lupus. And that has some early studies, one in China of 100 patients, and then one in France of just 20 patients. So we do have to realize that this is very anecdotal data. There hasn't been any randomized control trials. But if someone is extremely sick, especially developing respiratory symptoms, because what we see with the coronavirus is that it can cause a very severe pneumonia, and that's what's putting patients in the hospital and requiring people to actually be on ventilators. So for the patients that are sicker with the coronavirus, it is a consideration to have a conversation with the doctor as to whether or not hydroxychloroquine would be an appropriate treatment. The study so the study in France actually added Zithromax to the hydroxychloroquine, because Zithromax is used to treat a lot of common other upper respiratory infections and pneumonia. And what they found in those 20 patients, so we're only talking 20 patients, but what they found by day 6, their viral load, meaning the amount of virus that they had in their body, went to 0. So we do know that the medicines can be effective. The issue is that hydroxychloroquine especially has interactions with a lot of other medicines, and interactions that can cause severe arrhythmias that can be life-threatening. So heart rhythm problems that can be very serious. So it's not something to just prescribe to anyone. It's not something if you just have it or a friend has it to just go and take it. So I want people to really understand that that has to be a conversation between you and the physician as to whether this might be a potential treatment for you. But if the doctor feels it's necessary, then they want to screen every other medicine that you're taking and make sure there are no interactions. And in fact, the hydroxychloroquine and the Zithromax can potentially also have an interaction. And so on those 20 patients that they did the study on, those were all hospitalized patients that were on a heart monitor. So we still don't know the ramifications, but we do know that it's a potential treatment, and hopefully in the upcoming weeks or months, we'll have a lot more data so that we can be much more thoughtful if we need to prescribe those medications. And the other hot question is masks. So I'm going to throw it back to Dr. Richardson about should you be wearing a mask?
Should you be wearing a mask or not? There's a couple of different kind of masks. There is the regular surgical mask that you could have, okay, that we wear here at the office, and we everyone, especially if they come to the center, as being COVID-19 positive until we prove otherwise. So that's one. You can wear this one, but this just protects the person that's actually wearing it. It does not protect the people from that actually has it, giving it to you. So we also ask them to wear it as well, so we be protected. There's also the other masks that we're having a lot of folks that are actually making them, and these are really nice. We had these made from the community, and they actually have an air conditioning filter in between. So they are very, very useful, and they also are protective as well. And so when you're going out to the grocery store, not that we're advocating that you go out a whole lot, but if you go out, you may want to wear a mask to protect yourself so that you're not spraying anything. And if you're having cough symptoms or something, you need to be speaking with your physician. But at least this will
if you're
at least
sick, you should be
protect you.
staying at home.
But if you're healthy and you're out, these masks are good for that sort of coverage, that you can go out, that you can actually wear and not spread the germs that you may have. But someone who's more symptomatic need to be talking with their physician.
So this is the other coveted N95 mask, and some people have these laying around in their garage because they have them for painting or cutting the grass or whatever. If you do happen to have one of these masks and you're caring for someone who is actually sick or symptomatic, this will actually protect any respiratory droplets from exposing you and getting you sick. So the regular surgical masks basically prevent you from spreading your respiratory droplets to someone else. But if someone is actually sick and symptomatic, you really need a 95 mask if you can get one, if you happen to be caring for that person who is sick or under the weather. You definitely want to wear gloves, wear a mask, and then of course if you can wipe down with bleach if you can find it, Lysol if you can find it. If you cannot find it, you can take hot water and hydrogen peroxide half and half. Or you can also use white vinegar. Most people can find that or have that in their household, and cut that half and half with hot water and clean down surfaces, and that does kill COVID-19. So we've got all the pearls and the tips here at Lake Oconee Urgent Care and Lake Oconee Concierge Medicine. We also have a website called Virus Update. And you can go on the website, and every week or every couple of days I'm updating new information. We have all of our clinical pearls. And definitely, if you're feeling under the weather, call our office, 706-484-0884, and we'll make a telemedicine visit. All you need is a phone or a laptop, either one. But if you just have a regular phone, that will work. Well, iPhone, but it doesn't even have to be a smartphone. I mean, in these days and times, as long as we can communicate and have a conversation with you, even if we can't get you on a picture or a visual, we will still treat you and take care of you.
Yes, so we're here for you, and we want to help the community. So let us help. Thank you.